Great. Hi, everybody. We're really excited to have Lizzie Sobel, who is near and dear to our hearts in the Boston area. She's a doctor of chiropractic and is a perinatal and pediatric chiropractor in Boston and Walpole, Massachusetts, where she has been practicing in the past 10 years. So Lizzie, we'd love to hear your story about how you got into this really specific and important care.
Absolutely. Thanks so much for having me talk today. Let's see. My own journey with chiropractic started when I was a kid, when I was 12 years old, and I started experiencing daily headaches and back pain. And my mom took me to see my primary care doctor, and he made sure, I didn't have anything really ominous going on. And actually, he was the one that suggested that we check out a chiropractor, which now looking back, I realize was incredibly progressive. I'm incredibly grateful for that small town pediatrician for making that suggestion. We had a family friend who was a chiropractor. My mom took me to start seeing her, and she started helping me right away.
In this chat, we kind of want to focus on the pediatric population because I feel like that's kind of an area where people are just unsure of when they should send kids because they're like, well, kids don't generally have a lot of pain. So we kind of want you to go into a little bit more of what type of patient you see, who generally gets referred to you.
Absolutely. And I mean, there's so much in there, just that question. The thought that even someone needs to be in pain to see a chiropractor, there's a misconception there, but also just, yes, I don't think a lot of people understand that chiropractic can be for kids. Definitely the vast majority of my pediatric clientele is infants, children under 1. Again, in that subset, absolutely the number one most common reason I'm seeing kiddos is for nursing, breastfeeding, bottling, some kind of feeding dysfunction.
Can I back it up even even before that? So I'm seeing a newborn, they're complaining, mom's having pain, latches hard, whatever, all these things. And I'm starting to think there's an anatomical issue. I'm backing it way up. What am I doing when I put my hand inside that baby's mouth, and what am I feeling for? What am I looking for? Because I don't think, we certainly don't get training on this.
There's, again, it's a scale, right? It's not just yes, there's a tie. No, there's not.
Totally. And we're not saying that anyone's officially diagnosing the tongue tie. I think what we're hoping is people learn oh my gosh, I can highly suspect and then try to connect people with the right services and the right providers.
Yes. There are a lot of other things. First, certainly weight gain. That's always the first question. Are they gaining weight? Not that isn't exclusively going to be a tie issue, but it's certainly going to be another piece of the puzzle. I also always ask about output. How are their poops and pees? If they're not getting enough in, then they're not going to be able to get enough out. Reflux is sometimes increased. Again, as I said, if they're clicking and not having an effective seal, that means they're also going to be intaking a lot more air. So that can also lead to more gassiness, more irritability, discomfort after feeding. Again, all just kind of signs that something's not quite going right between baby's mouth and the nursing parent's breast or chest.
So can you talk to us, Lizzie, about your type of treatment and how gentle it is? Because I think when you hear chiropractic for a baby, you're like, what in the world? Why would you do that?
But I will always advocate wherever you're trying to find, to certainly find a chiropractor that's specifically trained in pediatrics. So this is, some chiropractic schools will offer some pediatric training, but honestly, most of us got most of our training postgraduately in seminars and specific organizations.
Abducting or whipping around and not seeing a midline. Are their toes pointing out? Are their toes pointing in? Because that all affects the body. So just taking a quick look at how people are walking into your room, how they're sitting,
slouching off, even what shoes they're wearing. I know you might not get into the weeds that much, but I certainly always talk about parents with that, especially the first ever shoes, when they're just turning 1. But yes, that is all so important. I think the first thing is that, or one thing I would like to say is that there is a lot of fear around it, right? I think especially when you're talking about kids, like, oh my gosh, I would not think that sounds awful. And I would just say, like, try, it can be a really safe, really effective modality to offer to your patients and also to your children.
Yeah.
It is. It's so important. And I think we just don't realize that it's out there. And your explanation and your teaching is just beautiful and so helpful.